Welcome back to The Beat. We're joined now by Marc Morial, President and CEO of the National Urban League, and Dr. Selwyn Vickers, Senior Vice President and Dean of the School of Medicine at the University of Alabama, Birmingham. In his USA Today op-ed, he writes something we should all consider, that the way minorities are being treated during this pandemic is creating a crisis within a crisis. Both of you have devoted a significant portion of your careers to these issues, Doctor. What do you mean by that?
Well, I think that the op-ed was really to speak to the fact that there were significant disparities in how different populations in our country were responding to the COVID-19, particularly African Americans, who were, as you showed, had a disproportionate suffering, particularly as it relates to death and even sometimes ICU admissions. And so it was to really convey that that crisis is real and it's across the country, as you just demonstrated in that chart.
Yeah, you mentioned that, and obviously, as a doctor, you deal with the data and the diagnostics. Let's take a look at these percentages where you see Washington, we mentioned 75% of the deaths. I mean, it's just such a disparity. Louisiana, 33% of the population African-American, 65% of the deaths. In the South, which has had a bit of a different experience at times with this COVID and different geographic patterns, 27% of the population of South Carolina on the bottom there, African-American, 55% of the deaths. Doctor, how much of this is preventable, treatable, and how much of this is a part of underlying systemic racism and health and economic disparity, and you'd have to treat the root cause?
So it's a really credible question. And when we look at individuals' health, there are really two big components. There are medical determinants and social determinants. And so when you look at the medical determinants of health, these pre-existing conditions were significantly higher in African Americans, particularly in the Deep South and some of our urban areas, whether it's heart disease, kidney disease, obesity, or diabetes. And when in this setting, those individuals have an infections from coronavirus, particularly COVID-19, their response has been challenging. And so you see the increased deaths.
Let's pause on that, and then I'm going to let you get, I think you're going to get to the second part. But on that point, what you're educating us on is there are underlying conditions that we know about medically, statistically, that exist. And this crisis has turned many of them into a death sentence.
That is correct. And then unfortunately, even if you're managing your heart disease or your diabetes, it doesn't relieve you from being at major risk of actually succumbing to this virus if you have it prior to getting infected. And unfortunately, African Americans have these in a disproportionate number compared to the rest of the population.
And then were you also going to add something, forward-looking? Sorry, sir.
Yeah, the other factor that really predicts our health and particularly relates to the African-American community are the social determinants of health. And you were indicating that inequities as it relates to access to health, poverty, living in high-density areas, limited opportunities for economic growth, all of those things can have an impact on whether someone is actually able to manage their health or actually able to prevent getting one of these chronic illnesses, particularly heart disease or hypertension or obesity. Those factors play into how someone is able to address their health. And subsequently, we're seeing this play out again as a factor of significance. When you look at the areas where the greatest mortality, it's not only those that are African American, but they happen to be the poorest too. They often have the least testing, and they often have the least access to health care.
Understood, and you lay that all out, such an important piece for citizens and policymakers alike. Marc Morial, big picture, because you work on this, civil rights, and how do you improve it, and how do you force change? And one of the first things which has come up, because I've interviewed you before, is in debates about race in America, there is a whole crowd that says a lot of the time, well, this is old, this is over. Why are we still talking about slavery? Why would we do reparations for something that I wasn't alive for, et cetera? It would seem this is another reminder, another proof, evidentiary example of why that is wrong, because this is right now, and people are dying, and there are economic and racial disparities that undergird the death rate.
Yeah, thank you for having me. And Ari, it ain't over till it's over, and it ain't over. That's the point, that there's a continuum of slavery and segregation and health disparities and social inequality in this country. And what the COVID crisis is doing is shining a spotlight on that problem in a huge way. And so this moment where African Americans have, in effect, a triple whammy, high incidences of death due to coronavirus, number one, high percentages of people who are in essential jobs and can't work from home. And thirdly, now we see high rates of unemployment. Speak to what Congress has to do and what the nation has to do to respond to this. So we need to fix the public health system, not fix it back the way it was, but fix it in a way that's more inclusive and more equitable. We need to understand that too many Americans are living paycheck to paycheck. And by missing a paycheck or two, they're now on food lines. The demand and the need for those who are food insecure has spiked. We're doing feeding at urban leagues around the country. We just completed a survey which showed that 80% of our constituents, the people we serve, list food insecurity as one of the highest needs.
Right.
This is the America we have today. Let's see this moment.
Let me press you on this, though. What's one thing you think government or Congress could do to help fix this problem as the doctor diagnoses it?
I think that we could close the loopholes in the access to healthcare system. Number one, expand Medicaid on a mandatory basis and close the holes in the system. Number two, expand Medicare so that people 50 and older have access to the Medicare system. Third, create a public option so that every American has access to health care, and then build a system
I'm over on time.
care.
I want to get the doctor back in, though, because let me take just one point. Doctor, you hear Marc Morial advocate, okay, if you lowered the Medicare there to 50, there's things we're hearing about. Somebody loses their job, right? Not their fault right now, 26 million. Then they contract COVID and they don't have health care. Is that the kind of policy you think would help address some of this?
Yeah, I think in general, Mr. Morial, Mayor Morial's statement is true. Access is really critical. It's not only critical to treatment, but it's critical to managing the public health needs of populations in this country, particularly African Americans. It's an opportunity not only to create ownership, but also for the system to also provide a unique chance for people to enter the health care and improve their lives. I think we're seeing that now. And the combination of high density, the essential workers who often are exposed, as well as the chronic diseases are the things that have really created this massive death toll in African Americans. So the answer is yes. I think it would be very helpful.
Well, this is an important conversation. We're going to keep doing segments like this to keep shining the light. Dr. Vickers, I just got to meet you. I want to thank you. Mayor Morial, since I already know you, I'm going to take a liberty. Are you ready?
Go ahead.
I'm going to take a liberty with you. I like seeing you in the workout gear at home. I like that look.
Hey, man, I haven't put on a suit and tie in 6 weeks because working from home, comfortable. I don't have on any shoes now either.
Great. Well, that's good to know. We got extra information, a little bit of a laugh during what are obviously hard times for so many. Thank you, sir. Thank you, Doc.